Hello class, my name is Lorelie Lopez and I am a student nurse practitioner here at Morningside College. Today I will be discussing my research project titled The Nursing Experience, Relationship Between Night Shift Work, Depression, and Sleep Quality. I chose this topic because as a night shift nurse myself, I was interested in the health effects that night shift work may have on the overall health and well-being of an individual. What I found was that night shift work is linked to many illnesses due to the disruption in the body's circadian rhythm. Also, there was a lack of studies that looked at night shift work as it related to life quality. For this reason, I specifically developed a research that would look at night shift work, sleep quality, and depression and try to find what the relationship were between these variables. The research questions for my study were: is there a relationship between night shift work, sleep quality, and depression in full-time night shift nurses? And is sleep quality and depression related to how long a nurse has been working night shifts? The theory that I used to guide my project was Engel's biopsychosocial model. This model proposes that there are three factors: biological, psychological, and social factors that affect health. Similarly, night shift work affects biological, social, and psychological factors. Biologically, night shift work affects the natural circadian rhythm. Psychologically, night shift work is linked to mental illnesses. And socially, night shift work is linked to disruption in sleep and therefore a disruption in social activities. Now I will be discussing the study itself. The sample was derived from the Facebook group Nurses of Austin, Texas. I used SurveyMonkey to upload a questionnaire into this group. The questionnaire comprised of the PHQ-2, the Patient Health Questionnaire, and the PSQI, the Pittsburgh Sleep Quality Index, and these questionnaires measured depression and sleep quality. This questionnaire was uploaded into this Facebook group for 7 days. After 7 days, I had 26 participants for this study, but only 20 met the inclusion criteria. These inclusion criteria involved being age 18 or older, being a full-time registered nurse, working night shifts primarily, living in the Austin metropolitan area, and having no previous diagnosis of depression or sleeping disorders. If you look at these charts, you will see a description of the sample itself. So we had 20 participants in the survey. Majority of them were female. We had 12 females and 8 males. And for the age group, majority of the participants were between 25 and 35. And night shift experience, 75% of the participants worked night shift for 12 months to 5 years. Over on this side, these charts represent the results from the PHQ-2 and the PSQI questionnaires. What we found was that if you had a total score of 5 or greater on the PSQI questionnaire, then it represented poor sleep quality. Of our 20 participants, 18 of these participants scored a score greater than 5, which means of 90% of our participants probably has poor sleep quality. A total score of 3 or greater on the PHQ-2 questionnaire indicates that major depressive disorder is likely. 3 of our 20 participants scored a score of 3 or greater, therefore 15% of the sample probably is affected by major depressive disorder. Kendall-Tau B coefficient was used to measure the relationship between the variables. We could not use Pearson's correlation because this was a non-normal distribution. What we did find was that there was a significant association between length of night shift experience and sleep quality, with a Kendall-Tau B coefficient of negative 0.40 and a p-value of 0.04. There was also a moderately strong relationship between sleep disturbances and depression. What does this mean? Well, the results from the study indicates that there is a relationship between depression and sleep quality. The more depressed the night shift nurses are, the less likely they are to have better sleep quality. They have more poor sleep quality. There was no significant association between depression and the length of experience for the night shift nurses. However, there was a significant association between sleep quality and the length of night shift experience. The longer the nurses worked night shift, the more likely they were to not experience bad sleep quality. They had better sleep the longer they worked night shift. Limitations of this study included a small sample size. We were not able to get a big sample size from the Facebook group. However, this just means that more studies would have to be completed in the future. Here you would find some references from this project. Thank you so much for listening and have a good day.